This skill is denture care as well as mouth care when a person does have dentures. So let's begin. Hi, Sarah, it's Ann, your aide. May I come in? Hey, how about if we get your teeth cleaned up? So is this a good time? She says yes. Okay. So I'm going to put my barrier down. I have a barrier, a pair of gloves, and a clothing protector. Set this down. I'm going to sanitize my hands until dry. And then I'm going to close the curtain for privacy. I am going to be putting Sarah into an upright position, also known as a high Fowler's, but so I'm going to be moving her. I have to make sure that the brakes are on. Okay. I'm going to get Sarah ready. I'm going to move my stuff around where I can get it. I'm just going to put the head of her bed up. And anytime we're changing position, we want to make sure that we ask them if they're dizzy. Sarah, you feeling okay? She says yes. Are you dizzy at all? No. And I want to put her in an upright position so she doesn't have any opportunity to choke on the liquid. How's that feel, Sarah? You feeling okay? She says yes. Sarah, I'm going to put this clothing protector on. Would that be all right? I'd just like to keep you nice and dry. She says yes. Okay. So Sarah has an upper plate and her lower teeth are her natural teeth. So the very first thing I want to do is gum care on her upper teeth. I'm going to put my gloves on, gather my supplies, which should be located in the top portion and the top drawer of the nightstand. In here, I'm going to have 2 cups. One I'm going to fill with water. The other she's going to spit in. And I'm going to go get that right now. Always use a barrier to turn water on. And I want to make sure that this is cool water. I don't want to use hot water. Okay. So we have 2 things in our basin. We have a toothbrush, which I will use on her bottom teeth, and this is called a spongette or a toothette. It automatically comes with some kind of dentifrice in it to help clean the gums, but it's nice and soft. I'm going to move this over a little bit. First thing I'm going to do, though, is have Sarah test this water, and it's really because I want her to moisten up her mouth a little bit. Sarah, would you test this water for me, please? She swishes that around a little bit. How's that? Is that good? I'm going to wet my sponge, and I'm going to use it on the upper gums. So I'm going to go in, rubbing on the upper gums, getting her upper palate in between her cheek and gums. That looks pretty good. And then I'm going to have Sarah swish and spit. So I'm going to give her a little bit of water. She's going to swish it around. Go ahead and spit in there for me, Sarah. Oh, thank you. And just like when you go to the dentist, you want to make sure, for dignity and respect, that you're dabbing at their mouth. How's that feel, Sarah? She says that feels great. Okay. So next, we're going to brush her teeth. If I can open the toothbrush here. I'm going to wet her toothbrush a bit. I'm going to put just a little dab, just like a pea size or a little bit smaller than a pea size of toothpaste onto this toothbrush. Her mouth is already wet, so I really don't have to have her wet or whistle again. And I'm going to brush all surfaces. I am looking to make sure, I want to make sure there's no kind of problems in her mouth, any cuts, any areas, loose teeth, anything of that nature. How's that feel, Sarah? She says that feels pretty good. I'm going to hold this brush, her spit cup, and I'm going to rinse. Go ahead and rinse for me, Sarah. Swish that around a bit. Spit. Great. Dab her lips. And one other portion of the mouth that has to be washed, and that is the tongue. Sarah, stick your tongue out at me. Oh, great. You want to make sure you don't put the toothbrush back too far because you definitely don't want to gag them. I'm going to have her swish and spit again. Swish, spit. Wonderful. How's that feel, Sarah? She says, good. Does it feel like I missed anything? She says, no. Okay. So at this point, I'm done with all of my supplies here. Then I'm going to go ahead and take care of these in the sink. We're not going to be reusing any of this. Her toothbrush, we will. I'm just going to go ahead and dump this water right into the toilet. Dispose of the cups. I'm going to go ahead and rinse her toothbrush out. Just because I don't like to put things back into somebody's basin with toothbrush or soap all over them. And then I'm going to put this back in her basin. I'll put her basin back in her drawer. Sarah, you feeling okay? She says, yes. I'm going to go ahead and take your clothing protector off. All right. I'm done with my barrier here, so I can go ahead and get rid of this as well. Tidy up the room. So now that I'm done with that, I still have my gloves on. Sarah, I'm going to go ahead and wash your dentures. Is that okay? She says, yes. So in the overbed stand or the bed stand, you're going to find a denture cup and an emesis basin. And really, we don't even use the emesis basin. So there's a couple barriers that we need. Everything is going to be in the bathroom. Sometimes I use 2 barriers to put the stuff on, but you can do it with 1. So I'm going to set the basin there. I have the denture cup. And I'm going to take the lid and just set it down there. It has in it dentures, which have water in the cup. I'm going to make sure I get a good grasp on the denture. And I'm going to dump the water. I'm going to put the denture on the lid. Whenever we're working with dentures, we always use cool to cold water. You never want to use hot water because that could actually deform the denture. I'm going to wash all sides of the cup. And then I'm going to fill it with water. Before I start washing my dentures, I need to put a barrier in the sink. And this serves a couple purposes. I'm going to put it right over the drain. I'm also going to turn my water down just a little bit. This helps fill up the sink a little bit. And it also forms a cushion so that if I were to drop the dentures in the sink, they wouldn't be as apt to chip. All right, I'm going to go ahead and get my brush ready. You'll see that a denture brush is a little bit different than a toothbrush. You have 2 sides. The flat side is good for getting the tooth surface, and the pointed side is really good for getting the top side of the gum that meets the palate to help get some of the adhesive off or some of the bacteria. Again, you just want to do just about a pea size, but you're going to do both sides of the toothbrush. And it gets a little bit tricky here because you want to make sure that you're always securely holding onto the denture. So you're going to pick it up and you always put it into a cupped hand like this. So I just want to test my water and make sure it's still cool. I'm going to rinse this and I'm going to start brushing. Always holding the denture securely in a cupped hand. I can also take the pointed edge and get into this side of the denture. I always want to keep it over the sink. And then when it comes time to flip it, I'm not going to do this. I am going to take my pointer finger and my thumb. I'm going to securely hold it, flip it into my cupped hand, and then I'm going to wash the other side of the denture. I always want to make sure that I clean all surfaces. I'm also looking for any kind of chips or broken portions of the teeth. And then I'm going to rinse. I want to flip this over and rinse the other side. So I'm going to grab it with my thumb and my pointer finger and I'm going to flip it. This goes right into the clean water. You always want to put dentures in water. Yeah. I have one more piece to clean, and that's the lid. So I want to clean both sides of the lid. Okay. I'm going to turn my water off. I always like to dry the cup off a bit. I don't like to put wet cups into an overbed or a bed stand. I'm going to take this and put it back before I come back and clean up my dirties. One other thing I need to do though before I put it away is, Sarah, would you like to have your dentures back in? And she says no. She's ready to go to sleep. So I'm going to put her dentures back here. I'm going to come back to the bathroom. Now I have two barriers, one on the ledge and one in the sink. The one in the sink is the dirtiest, so I'm going to do that one last. So I get the barrier on the edge of the sink, and then I pull the barrier from inside the sink. At this point, I am done with the skill as far as with my gloves, so I'm going to go ahead and take my gloves off, cupping my glove so that I can pull it off, folding it onto itself, going at the top, and pulling that glove over the other one so they are both contained and they go into the garbage. This is not a hand washing skill, so what I'm going to do is, as soon as I'm done with that, is I'm going to sanitize until dry, and then I'm going to do the ending skills with my resident. Sarah, are you comfortable in that position, or would you like to lay down? She'd like to lay back down. So I'm going to go ahead and put the head of her bed down, after which we will do the 3 L's, right? Her bed is still low, and we're changing positions. Sarah, are you dizzy at all? She says no. The bed is low. It is still locked. Sarah, would you like your call light? You got it in your right hand? She says that's fine. Okay. And at this point, there's nothing more that I need to do in the room. I've checked. I've got everything taken care of. She's comfortable. Did my 3 L's. I'm going to pull the curtain, and then I'm going to sanitize until dry. And I'm done.